Treatment reporting is a very unglamorous but essential part of what we do. Why is it important? Well, it's important because we need to be able to compare the treatments we give, both between our institution, our own institutions, and between other institutions. We need to be able to compare treatments given from different devices. We all use different systems, preclinically and clinically, and we need to know that we are, when we're discussing them, we are comparing exposures properly between treatments or between experiments. We, in our own institutions, need to be able to repeat our treatments, our exposures, and therefore we need to know what it is we've done. There are a number of important reporting categories. Those are transducer and the system that's used to drive it, the protocol we use for the exposure, the power and intensity that we use, and the pressure field distribution. If we're looking at cavitation, the monitoring methods that we use. If we're interested in heat, what are the thermal dosimetry methods? Again, if we're interested in bubbles, what are the bubbles we're using? What are their characteristics? How are they injected? If we're just doing modeling, we need to know the simulation details. We need to know what equations are being used and how they're being implemented. And it's important that we know that people are doing proper quality assurance and the methods that they're using. The important parameters, well, the transducer and its system, as I've said. We need to know about the transducer geometry, the material of the transducer, how it's characterized, a bit about its drive. We need to know about the acoustic power as a function of setting for the devices we're using and how that's being measured. And we'd like to have information about the spatial variation of the acoustic intensity. We like to know the spatial variation of the pressure field as well, with peak positive and peak negative pressures being listed. And how is that measured? What sort of hydrophones are being used? What are their characteristics? How's the data being collected? And how is the scanning done? At what spatial resolution, for example? When we're interested in cavitation, we need to know specifications of the experimental system, the PCD, the imaging array, how's the signal acquired, how is it processed, and what metrics are being used to define cavitation. If it's heat we're interested in, we need to know about the thermocouples. We need to know the recording parameters. We need to know, are we using magnetic resonance thermometry? And if so, what are the sequences being used? How is it being processed? We'd like to know about thermal dose. Again, for bubbles, we need to know the type of agent being used and their characteristics. We need to know what dose is being injected, and is it being injected as a bolus or as a continuous injection? For modeling, we need to know the equations being used, how they're being implemented, how they're being validated, very important and often forgotten, and what system geometries are being modeled and what are the inputs and outputs to those models. And for quality assurance, we need to know how that's being done. Is it being done with a phantom, with a hydrophone, for example? How often is it being done and what's being assessed? We've come up with some reporting categories that we refer to as minimum, medium, and optimum. At the minimum level, and we see this as being suitable for, really only suitable for people in the clinic, it gives us a minimum of information about the treatments being given and the machines being used. Then we have the medium level, which is a more inclusive list of details that's being required with some measure of the acoustic fields. And we see this as being suitable or achievable and okay for research-oriented clinical units and some more biological labs who don't have access to sophisticated calibration techniques. But of course, we would like everybody to be using the optimum reporting category, which contains lots of details about everything. We understand that this may be difficult to reach for clinical units that are mainly clinical, but most research labs should be aiming at this level of reporting. And as I said, we see the minimum, the medium and optimum as being the levels at which preclinical studies should be reported. So let's look at those in more detail. The minimum level, and as I said, this should be for clinical units only. We need to know about the treatment protocol. So where is the transducer, its position relative to the tissue or anatomy being exposed? What is the treatment planning strategy? What are the treatment settings? Information about the transducer geometry and its centered frequency and its focal length, for example. And if cavitation agents are being used, what are they? How much are they being injected? How much of them are being injected? How are they being injected? And where data monitoring is provided, and we hope that this is in the majority of places, what is the peak temperature? Do we have cavitation? Is it there or not? And what are the quality assurance procedures that are being used? So this is the minimum level. And if we look now at the medium level, we would expect the minimum level of reporting at least, and into which we want to add more detailed information. So these are for clinical studies, more detailed information about treatment parameters, the transducer and the acoustic field. So we need to know what's happening at the focus in terms of power, intensity and pressure. And how is the power being measured? Is it using a radiation force balance or a hydrophone, or preferably a radiation force balance with a hydrophone? And what are the transducer characteristics? And then we need detailed temperature information, including details of the methods used, so thermal dose and temperature maps. Preclinically, this category requires all of that, but we're adding that we want more details about the methodology, about the temperature mapping, how it's achieved, and the cavitation. And we'd like to see some details about how bioeffects are being assessed, so what histological techniques are being used, and so on. And if there's a quality assurance procedure, we'd like to know what that is. And at the optimum, the Council of Perfection level, everything that's included in the medium level, of course, plus a more detailed characterization of the acoustic field. So either 3D or a 3D plot or an axial plot with some radial beam plots with their location being given very accurately, but especially quantification of the intensity and the pressure at the region of interest, so in the target volume. We need a detailed description of the monitoring methodologies. So how is thermal dose acquired? What are the peak and average temperatures? Are there temperature maps, and how are they recorded over time? And if we're interested in cavitation, where is that cavitation? How is it monitored? And what type of cavitation is being monitored? Where simulations are being used for treatment planning, what are the equations being used? What software is being implemented? And what parameters, what material input parameters are being used? These categories are based in large part on a publication from 2011 in Ultrasound Medicine Biology. There will, we hope, be another publication on this specifically for HIFU coming up, but I suggest you should go and look at this 2011 paper. And also there is more recently a task group of the AAPM produced a medical physicist guide to MR-guided focused ultrasound body systems. And that's certainly worth going to look at. There are a number of relevant standards that are referred to. These are, for physicists amongst you, these are the 60601 series standards, but they cover things like power measurement, field characterization. They cover surgical systems. There are standards for physiotherapy systems as well. And then the AIOM has also produced standards for real-time display. So the MI and TI that we used to for diagnosis. What this really all emphasizes is that we need to collaborate. The reporting categories are important. In my view, people should not be allowed to publish without very detailed explanation of exactly what they've done and how they've measured it. And that means that we really need to combine the skills, not only of the clinicians and biological scientists, but of physicists and technical people as well, in order that this is done properly. And we as a community should be doing everything we can to make sure that our work is reported properly. Because if it's not reported properly, it's not worth very much at all to people working around us or following on from us. Thank you very much.